already, and we're going to talk about the pit. The last two episodes, 11 and 12. I think it's 11 and 12. I've lost track. So, good morning. Good morning. Good morning. I'm also streaming over on Substack, but I don't think anybody's going to be over there. So, let me get the. Oh, there we go. Yep. There we go. All right. Is everybody caught up on the pit? Michelle, thank you for the Daily Heart Me. I'm multitasking here because I watched both episodes 11 and 12 yesterday, and I got a lot of thoughts. A lot of thoughts. All right. Is it good evening? Good evening where you are? Where are you that it's evening? You haven't even started the pit yet. We're in season 2. Got to get on it. Yeah, Robbie is in desperate need of a vacay. He is getting a little surly. Now, granted, there's a lot going on. So, EVS, thanks for the follow. I appreciate that. Coffee. And my new shirt, burnt out but optimistic. It really is a good show. Like if you liked ER, this is like kind of like a modern day version of that. It's pretty accurate. So I mean, it's definitely got some good drama to it. Signs of burning legs. They're on fire? I don't know. If you have a burning sensation in your legs, that definitely could be something nerve, which I would be concerned about, like maybe in the like a spinal cord. So you should get that checked out. All right, what are we listening to today? I think we'll just continue where we were yesterday. 2000s rock essentials. Look at that. Okay, I'm a diabetic. Okay, so yeah, diabetic neuropathy can cause that. Looking for sodas, so I went back Diet Coke. No more sweets for me. That's good. You need to limit that sugar intake. Oh man. Yeah, yesterday did not go as planned, as most days are, right? We had planned to finish this closet that we've been working on for a while. And it's just things get in the way. And yesterday things got in the way. It ended up being a cleaning frenzy. ADHD, give a mouse a cookie kind of thing. So you start to do something to make room to do the clean, like to get the closet finished, and then that like escalated into full scale vacuuming, picking up everything, dusting, and then it was like 3:00 in the afternoon. Like, well, we can't do it today. I can't finish it today. Let's see. Burning in feet, pain all the time. Any info? That sounds like some type of neuropathy, and you should definitely go see a doctor. You could have any number of things. So that definitely warrants a visit to your primary care. I don't know for sure what it is. It could be, like I said, it could be any number of things. So, but definitely go check it out. You are welcome. Welcome in. Thanks for the follow. Appreciate that. Yeah, it'll be interesting to see what happens on the other side of things, on the other platform. Most of my folks are here, for sure. So, okay, episode 11, we're dealing with the frozen water, ice, um, coming into the ER with a detainee. Now, from what I understand, this episode was written in January 2025. Like before everything that is happening today is happening. If that's the case, then this episode was prophetic, like more so than The Simpsons are. So it was really kind of, I mean, it looked like what we're seeing today, and it's kind of scary. Nurse Jessie, the actor who is also a real nurse, apparently picks up PRN shifts in a Los Angeles hospital. He was arrested. He was detained by ICE because he was trying to protect a patient. They were hurting the patient. He tried to step in, and they took him too. Let's see here. Was schooling hard? Yeah, nursing school is, yes, very hard. Yes, nursing school is very, very challenging, very competitive. Um, you got to have anatomy and physiology, pathophysiology. We had 2 semesters of pharmacology, which was really hard. You've got your critical care courses. So yes, it's very challenging, and they grill you constantly. But you want them to do that. Danny P, thank you for the Go Poppers. I appreciate that. Oh, we're gonna skip this song. Not a big fan. There we go. Velvet Revolver. Much better. Gilberto, thank you very much for the follow. Appreciate that. Michelle, thank you for the roses. Appreciate that. This is my new shirt. I showed it yesterday. Burnt out, but optimistic. Hey, what's the difference? Let's see. How's this go? I'm terrible at jokes. Let me think about this. Okay. I gotta think on this. Hang on. Burnt out but optimistic. Good morning, Amanda. Welcome in. You're up awfully early. Are you working today? Michelle, thanks for the TikToks. I appreciate that. Yes, there are 2 microphones here because I am also over on the stack, probably to an audience of 0. But you're not going to get an audience unless you go live, right? So we're going to do that. So we're talking about The Pit, episode 11 and 12. So episode 11, I'd seen all the spoilers, and it's fine. It's not like a big thing if you find out. You've probably seen the social media post. So ICE comes in with a detainee. They rough her up. They claim that she fell or ran into a wall or some ridiculousness like that, which happens every day here. So no work. Boys have to go to school. Oh, gosh, you got to get them up. I always forget about the kids, right? You got to get up and get them running. I'm just kidding. I don't forget about my kids. So ours go to school today. Oh, look at that, Michelle. Thank you so much. I appreciate you. Reminds me of my trip out west to Arizona. Our boys got cowboy hats. Still have them, actually. They still wear those things. The cowboy boots that we got do not fit them anymore, and that's okay. But they were like legit cowboy boots. So we'll have to pass those on to somebody else at some point. Michelle just like making it rain today. Appreciate you. Look at that. Hand hearts. Holy smokes. I'm feeling the love this morning. We got Velvet Revolver in the background. It's Monday. I don't have to work. I'm off this week. I'm off until like the following Wednesday, like a week and a half, almost 2 weeks off. I totally forgot I took this leave. I totally forgot. Oh, Michelle's coming out with a corgi. Don't let Holly see you do that. Danny P's off too. Danny, I was getting ready to go live, and I scrolled across one of your videos. I think were you putting together a salad? I think you were putting together a salad or something. And then I was like, oh, I got to go live. So I didn't get a chance to watch it all. Michelle, thank you so much. I appreciate that. Honestly, I don't even know what's in my gift gallery. Yeah, I don't know what that is. I get notifications like, we've refreshed your gift gallery. I'm like, okay, cool. I don't know what's in there, but I appreciate you. That's awesome. How many things have you had to pull? No, I've not had to do any of that. And typically we don't do that in the emergency department. If it's up there, then it's usually going to require surgical intervention because that's like a vacuum. That's why you got to have a flared base. Ames created, she said that'd be a great name for a band, Flared Bass. So she actually made an album cover, like an AI generated album cover called Flared Bass. It was hilarious. It's over on the off-duty nurses what do you call it? Discord? Yeah, it's on there. X Dubs, thanks for sharing out the live. Appreciate that. Oh, Ludlow, what medication do I dislike giving the most? Without a doubt, it's rabies immunoglobulin. Yep. It takes forever. It's weight based and it's a lot of them. Unless you're really, really tiny, like Amanda Donnell is like 5'2", like 110 pounds. So she would probably get like a couple of shots maybe. But like me, I'd get like 7. Yeah. Because it's all weight based. And those are and you got it. And the worst part is with those, you have to go directly into the puncture sites. So you get bit by a wild animal, booping those snoots. I have to actually inject that directly into the bite marks, the puncture marks, and that is very, very uncomfortable. Do I do suturing? Yes, I can. Um, but it has to be under the Amanda says, "I'm big." Right. I know you're big. Up here, you're big. I like that, and down here, a big heart, but that does not translate to physical stature. Physically, you are still petite. And that's good because if you ever get bit by something and you need rabies shots, you don't have to get as many. So that's good. I've done suturing, but it has to be under the direct supervision of an attending physician. And I've gotten to do them a couple times. I'm trained on them. I can do them. I am trained to put in chest tubes. It just depends on what your facility allows. I'm trained to intubate. I'm trained to crike. I'm trained to do a lot of things. But it depends on your facility. Some facilities don't allow nurses to do those things. Like I can't intubate at my facility, even though I'm trained. I've had the training. I've probably done more intubations than some of our physicians. But in the hospital that I work at, I can't do that. Hydralazine? What is it about hydralazine? I mean, that's really not a good first line medication. We shouldn't really I know there's still doctors that prescribe that, but we really shouldn't be doing that as a first line for critical hypertension in the ER. Do you find it difficult to give report to ICU nurses when transferring? Um, I think they ask a lot of questions, and I feel like, Kevin James, like, I don't know. I don't know. I don't even know what that is. Okay, thanks. They ask me a lot of questions. I used to be an ICU nurse, but I haven't been an ICU nurse for a long time. So, you know, it depends. A lot of the ICU nurses up there know me. I help them out a lot with midlines and IVs. So they're usually pretty when they hear me call and report, and I'm a pretty chill guy. Like I think most people get along with me pretty well. So I don't ever really get any pushback from the ICU. They're usually I give a pretty thorough report, answer the questions. I try my best to put them in gowns. ICU gowns, our ICU and PCU have to have special gowns. So I make sure I put them in the right gown, which I didn't know that until our one of our techs told me that. So God bless the techs for keeping me out of trouble. That's right. They're alive. That's what matters. Yeah. They have IV access, still breathing. They're on the monitor. What else do you need to know? Don't even ask me about their skin. I didn't look. How do you deal with endometriosis patients who present with their So I actually don't see a lot of that, Gypsy. I work at a VA hospital, and while we do see female patients, we do not. We typically don't. I've never seen a patient come in for that. They're usually going to go somewhere that has like that specialty, and we don't specialize in that. But I mean, I've been reading a lot up on endometriosis and who is it? Authentic Nurse Noah. He's a nurse practitioner that works with, I guess, gynecology, female patients, and he does an educational series on that. So I've been learning a lot from him. So if you don't follow Authentic Nurse Noah, he's a good one to follow. Does a lot of educational stuff. 32-year-old male, BP 156/110. Ooh, that was like what my blood pressure was when I had my hypertensive encephalopathy. That's really high for me. Go to ER or call for doctor's appointment. Depends if they're symptomatic. 156/110, that's not a good blood pressure. That is definitely something that warrants attention. So first thing I would do is call for an appointment with your doctor. However, if there are symptoms involved, any type of vision changes, blurry vision, headache, balance issues, any type of chest discomfort, that's an emergency department visit immediately. ICU nurses rule. Yeah, they're all right. They're okay. No, they're fine. Yeah, it depends on the patient's history. So asymptomatic hypertensive tension like that may not necessarily warrant an ER visit, but if they're having symptoms, that does. There's something about you tells you I'm an awesome man. I like to think I'm a good person. I mean, I am definitely have my issues, and I've definitely made a lot of mistakes in my life. The 20-year-old version of me was probably a douchebag, but I I like to think I've matured, and part of that was getting out into the world and meeting people, getting out of my town and going to college and meeting people from different backgrounds and countries, and I think that made a huge difference. Are you familiar with cyclic vomiting syndrome? Yes, we see that fairly regularly. I'd say I probably see that a couple times a month, and it usually involves, cannabis or something like that. But the challenge is that a lot of the folks that come in that have that are on, cannabis for like pain or something like that or something else. So it's hard for them to kind of find that balance. So we just treat the symptoms. Oh, okay. Let's see here. No, 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 no. Whoa, whoa, whoa. I just got caught up on there. Yeah, no, we're doing that. No, absolutely not. Sorry about that. I just caught that. I don't have any moderators in here right now. Sorry about that. That's inappropriate. We are not advocating for any of that. Let's see. Good morning from Cape May, New Jersey. I've never been to Cape May, never heard of Cape May, but now I have. Let me see here. Catching up. Scrolling back. All right. So I'm back to the cyclic vomiting. Yes, talked about that. Yes. You can go to my bio and I've got my link tree in there. You can find it there. It's called Off Duty Nurses. Dana, United States Marine Corps chick, Santa Rose, thank you very much. Appreciate your service. Stay away from those crowns, Dana. Judy Gale, JoJo, and Jill Pickle, and Dana. Thank you very much for the follow. Appreciate that. Cassandra Johnson, like they don't believe me. What did I miss, Cassandra? Oh, here we go. Some ER docs look at me crazy when I say I have CEDS and immediate want to know who diagnosed. I don't know what CEDS is. So I don't know what that is. But I'm sorry that that you feel like you're not believed. I have a shoulder. This is Big Cal. I have a shoulder injury from 4 years ago, and it's been getting more painful now. Hard to breathe. If it's hard to breathe, probably need to go see a doctor, maybe an emergency department. Any difficulty breathing, I would want to get evaluated right away, especially if it's your left shoulder. Left shoulder, short, like difficulty breathing, I'd be concerned. I'd want an EKG for sure, just to rule that out. Most likely it's not that, but it's an easy thing to do. A little Metallica in the background. I've had that I've had that when I was 15, endometriosis, polycystic ovarian disease, and fibroids. Oh, Jill, you've had a rough go of it. Are you familiar with cyclic vomiting? Yes. Yes. Yes, we see it. I see it a couple times a month, I would say. No symptoms, call your doctor. Allison, just call your doctor. And if you have a blood pressure monitor, it sounds like you do, just monitor it. When you're checking your blood pressure or a family member's blood pressure, you want to make sure it's consistent. Like it's the same time every day, same conditions. So usually what we recommend is that when you get up in the morning before you eat or drink anything, you go sit down somewhere where you can sit upright like I am, feet flat on the floor for at least 5 minutes. And then you take your blood pressure in the same arm, resting, and then keep a log. And what you want to do is kind of track that trend and note any symptoms you may be having. But if you're having symptoms in your blood pressure, like the 156, the systolic, that's not terrible. Like I don't want that blood pressure for a long time. But the diastolic, which being over 100, that's a little concerning. So I would definitely want to monitor that. But if you have any of that and symptoms, like I described earlier, then that's definitely need to go to the ER to get checked out. Well, Aerosmith. You saw Disney finally took down the Aerosmith ride. They didn't take it down. They're just rebranding it. It's going to be the Muppets now. But the Rock and Roller Coaster, if you've ever been to Disney World and you've seen the little video that they play, I mean, that was like probably 20, 30 years ago because they definitely don't look like that now. But our youngest one loved that ride. He was 7 when we went there, and man, he rode that thing like 4 times. Yes, we all have skeletons in our closet. I'm way behind on these, so sorry. I've definitely matured as I've gotten older. I've learned a lot, I've made a lot of mistakes, and I've just tried to do better. I mean, that's all I can do. I'm just glad social media and video and the internet wasn't around when I was 20 because it would be an embarrassment. Would be People would be pulling up all these videos, it'd be awful. Let's see, Shauna. Yeah, I'm trying to get to everybody. I had like 51 new messages. Let's see. Oh, connective tissue disorder, like Ehlers-Danlos. I've got a friend who has that. A couple. Yeah, there it is. Classic Ehlers-Danlos. Yeah. I've got a friend who has that. I think passed it on to her daughter too. So yeah, there's like it's like certain things like she can't do artificial nails. It doesn't work for her. Ah, coffee. Got to have coffee. Let's see. Rolled my ankles 8 hours ago. Can I wait until Tuesday to go to the doctor? I mean, you can as long as there's no obvious deformity. Um, I would just in the meantime. This is for Slim Mick. Um, There's probably gonna be a lot of swelling. If there's any concern over like a broken bone, then definitely go get an X-ray. Like go, you don't have to go to the emergency department. You can go to like a minute clinic or somewhere that has X-ray capabilities, like Med Express, Minute Clinic, whatever those are. But they can do an X-ray if you have concerns about that. Now, if you've sprained your ankle many, many times, which I have, I know what a sprained ankle is versus, and I've fractured my ankles too, versus what a fracture is. No, which is interesting because our 8-year-old had been complaining of foot pain for like a couple weeks after being on a trampoline. He had full range of motion, but he couldn't bear weight. So my concern was like maybe like a hairline fracture somewhere that was weight bearing. And so we ended up taking him to like a minute clinic kind of thing that had x-ray. Actually, no, we took him directly to an orthopedic that had walk-in hours and they did an x-ray and he didn't have anything broken, but they did diagnose him with an ATFL, like partial tear or strain or sprain or something like that. So he's got to wear a boot for a couple weeks, go back, get reevaluated, and then most likely he'll have to go into um, a special type of brace that goes in his shoe. So, but yeah, no more trampolines. Don't let your kids play on trampolines. Those things are dangerous. What is the treatment for a Baker's cyst? Oh, I would have to look that up. So we can look that up. I haven't seen a Baker's cyst in a long time. Let's see. Um, treatment focuses on fixing the underlying knee problem, including rest, injections, or surgery, usually resulting in a good prognosis. So I have never seen anything in the ER done about that. Like they're not going to drain it or do anything like that in the ER. That's not what we're going to do. So I think we just refer them to, I don't know, orthopedics. I don't know who would deal with that. But it looks like it can be any number of things, depends on the severity, but it needs evaluation by like, I would say a orthopedic, probably. As someone with Ehlers-Danlos, you'll know if you sprain fracture. Yes, and it's a lot cheaper. If you go to, like, an urgent care, that's gonna be a lot cheaper than going to the ER, and most of them do, like, their pricing upfront, so sometimes it's almost cheaper to do out of pocket and pay cash than it is to go through your insurance. Ooh, torn meniscus? Yeah, that's not good. I've seen lots of those. Uh, Osteoarthritis? I don't even know what that is. I'm sorry if that's very painful. I'm not sure what that is. That's not something I see in the emergency department. But anything or osteo, that's bones, so you should probably go see an orthopedic doctor. Yeah, it's weird. Isn't that weird? Like how like if you pay cash, it's cheaper than paying like in some cases it's cheaper than paying your copay. Like our ER copay went from like 150 a few years ago, now it's 425 to go to the ER with good insurance. That's federal employee insurance. And it's like, yeah, sad. UTIs, what about them? Burning, Burning with urination is probably one of the most common ones. To antibiotics. Keflex is a common one. Finally getting my RN after 13 years as an LPN. Well, congratulations. When are you getting that? Probably meant osteoarthritis. Probably. But sometimes there are things that I've never heard of that I learn about during my live streams, and I love that. Graduating in 6 weeks. Congratulations. That's awesome. I assume you have a job lined up. You're going to go work for the same hospital that you worked for as an LPN? 200 if I go to my own ER, 400 if I got it anywhere else. Oh, you get like a discount for going to your own ER? I don't. I mean, kind of. I do get a little bit of a discount, even though I'm not a veteran. If I go there, like I like when I had appendicitis, I was at work and I checked in, and they did all the things, right? They did the CT scan and lab work and all that stuff, and then they transferred me. And when I say transferred, we did all the transfer paperwork, and then my wife just drove me because it was going to take like 3 hours to get an ambulance to transfer me. And we're like, no, we're not doing that. It's on the way home. So I just signed the form that said I'll transfer myself. And then I just walked in, and they all knew me because it was the hospital. It was the ER I used to work at. They were like, hey, we've been expecting you. So I got like the VIP treatment, which is nice. Came back there. I was there for like 10 minutes, and the surgeon that came in to take care of me, I used to work with him in the ICU. So it was like all people I knew. It was kind of nice, like made a stressful situation a lot better. And yeah, I had surgery that night and discharged the next morning. Well, I say discharge the next morning. We know how that goes, right? We're going to get you out of here this morning. No, you're not. It's going to be like 3 in the afternoon before I get out of here. And I knew that, and that's okay. I have PMDD, HEDS, POTS, and dysautonomia. Does it get easier? I don't have an answer for that. Peanut butter cup, I really don't. I mean, that's a lot of stuff to deal with. I'd like to say it gets easier, but I think that really depends on your medical team and who is helping treat you for all of those things. So I think that would really depend on them. I hope it does get easier for you because that's a lot to deal with. Oh, you actually get a discount to go to your own ER. So I've heard that if you work for Stanford Health, like out in California, if you work at that hospital, like you get free healthcare. I've heard that. And then I think I actually looked it up. So let me double check that. And because I looked it up and I was like, holy moly, that's true. Let's see here. I'm looking it up. Let's see. No, maybe that's not the hospital. No, they get some benefits, but it's not free. Somewhere over there did. I don't know who it was. I'll have to ask her. Let's see. I sound like your dad. I'm AFib, urgent care, said straight to ER. He came here to show. Oh, interesting. Okay. Yeah, no, should go straight to the ER. I mean, AFib in itself, like, is not necessarily a medical emergency. If it is the first time you've had it, then you don't know what's going on. So your heart, you don't feel good at all. And so that's kind of scary. But if you have a history of AFib, a lot of times people come in and out of AFib. And if you're already on a anticoagulant, which most people that have AFib are going to be on something, Pixaban, whatever it is, then unless they stay in a sustained RVR, then there's not a whole lot we're going to do. We might give them an extra dose of their rate control medication, which is, I think, metoprolol is probably the most common one that we see. So a lot of times they forgot to take it, skipped it, something like that. Can I drop your playlist? Oh, it's not my playlist. It's Apple Music's playlist. It is just 2000s rock essentials. That's what it is. It's not one that I curated myself. And that's Dave Matthews. Got to meet Dave Matthews many moons ago. The TV station I used to work for was in one of his videos because he's from Charlottesville. I used to work in Charlottesville as a weekend sports anchor, and so our I was off that day, which really made me mad. But they did record a video in our studio, which is really cool. Let's see. Oh my gosh. That's inappropriate. We're not talking about that. I am somebody left a kind of a crude comment. Um, I'm LGBTQ plus friendly, and we'll leave it at that. I have a adult trans child, so if you are anti-trans, you may see yourself out because I welcome all in here. Can a new RN work directly as an ER nurse? Yes. Most hospitals are going to have some type of new nurse residency program, regardless of what unit you get hired to work on. The ER is no exception. Most of the time, it's going to be at least a year long. They will set you up for training with PALS, which is the pediatric ALS. They're going to set you up for TNCC, which is trauma. They're going to set you up for ESI, which is triage, and anything else that you need. They're going to bring you along slowly, start you off with like the lower acuity section, and you most likely won't work triage until you've been there for at least a year, and you won't work trauma until you've been there at least a year. You got to have a feel for the flow and how to handle the situations before you can actually step in. So you can work in an emergency department, but if they do it right, they're going to bring you along slowly and ease you into it. Otherwise, you'll get burned out a lot faster. And that goes with ICU as well. Maddie, thanks for sharing out the live. I appreciate that. If y'all would be so kind as to give that screen a couple taps, that would help. We had a really good live yesterday morning. It was one of the best ones I've done in a long time. And like 2,000 viewers total. Got like 102 new followers out of it. That was great. We had a lot of great Q&A back and forth, and we didn't even really talk about the pit that much. Supposed to be talking about it today. So for the pit, Shaker, thank you for the follow. For the pit, so Dr. Alashidi, she's like the one taking Robbie's place. She found out, Robbie told her that Langdon was gone for 10 months because he was in rehab for diverting benzos. And she totally flipped the script, right? Like she was all Langdon, pro Langdon. And then as soon as she found that out, her attitude toward him changed immediately. Suddenly he couldn't do anything right. She was saying, no, let's do this instead. So it was, and then Langdon was like looking around like, what just happened? And then Robbie, of course, was backing Alashidi. I can't even remember her name, but I think that's what it is. So yes. So just like that, he is now the bad guy in her mind. And I thought she was better than that because she did speak out about, giving people second chances. And for her to flip it like that was really, I don't know. And there's a lot of back and forth between Langdon and, you know, who supports him versus who supports Dr. Santos. I'm not a big Santos fan. Like I was in season 1, but now she's just like, I don't know. I get where she's coming from. But at the same time, she's a bully. Like she calls people these nicknames and then like they say, "Can you not call me that? I don't like that." And she does it anyway. I mean, that is the definition of it, right? And she has zero regard for them. Now I know she's got some issues that we've not seen fully addressed yet. I think she's got some evidence on her wrist, which I think are, concerning, and we haven't learned all of that yet. But it's a story that I think haven't been told yet. And I think once that story is told, we will become more empathetic toward her and understand her better. I feel like they've intentionally left out some stuff so that I mean, that's how characters are written. That's what the writers want. They want us to feel certain ways about certain characters until we get more information. And then that's how the character arc develops. So, like I thought Langdon was an arrogant, guy, and use my words, choose my words carefully. I thought he was pretty arrogant in the first season. Like thought he was the end all be all, definitely talked down to some folks. And, you know, and then when he started diverting, like I was totally team Santos. Like that took a lot of balls for her to step up and say that senior resident is diverting. And she was not scared to do it. Maybe she was, but she didn't come across as scared. And I thought that took a lot of guts for her to do that. That's a tough thing to do, rat out somebody that you work with. Because there are going to be some that are going to look at you like, you're the bad guy. So, and now she's so mean and doesn't want to give him a second chance. Does he deserve one? I don't know. Holly, good morning. Welcome in. Holly, somebody gave me a corgi this morning before you got here. I thought it was you at first, and it wasn't. It was somebody else. It was Michelle. Michelle gave me so more corgis the better. But good morning, Holly. How are you? It's a Monday morning. It's okay, Michelle. We love the corgis. If I see a cute corgi video, I will send it to Holly. There's little puppies with the big ears. They're adorable. My new thing is chinchillas. I want a chinchilla, but I can't have a chinchilla. Do you know chinchillas live to be like 20 years old? I mean, that's like cat length, right? Some dogs can live that way as well. Oh, Misty, if you were thinking that, please don't call 988. Get some help. I've been there. Please be safe. 988. Holly used to have 3 chinchillas. Really? I didn't know they could do that, Lauren. That's a hard stop. I mean, cats technically can. Are those Cocas? Are those the ones that smile, that always look like they're smiling? They're like real, every time you look at them, they just look like they're smiling at you. Very docile. Michelle has a ferret. Oh, I follow, there's an account. She's a nurse. So Long TikTok is the name of the account, and she has, ferrets. I think I followed her because of the ferrets, and I was like, "Oh, she's also a nurse. That's cool." She doesn't really do any nursing content. It's all her ferrets, and they're, like, mischievous, as ferrets tend to be. So did anybody see episode 11 of The Pit with the ICE agents in there? What were your thoughts on that? I think the thing that I was not expecting, I had seen clips of it, but the thing I wasn't expecting was staff leaving, nurses leaving the hospital, EVS staff leaving the hospital and people in the lobby leaving the hospital. I thought that surprised me. Like the people in the lobby, that made sense, but the staff leaving was concerning. Oscar loves animals all big and small. Yes. My 8-year-old is Dr. Doolittle. He loves all animals. Everything's cute. Snakes, frogs, rodents, everything. He wants one of everything. Theory Smasher, welcome in. Is euthanasia you think good thing? They're just I think that we need to be more understanding of that as an option, I think is what I believe. I've seen so much suffering as a nurse, and sometimes I feel like it's needless suffering, that there should be a way out. Yes, I agree. I think but that's what they do. I mean, that's what we're seeing. I mean, we saw that in Portland just yesterday. Like they tackled somebody in an inflatable costume and like beat them because of what? Like they weren't armed, they posed no threat. They just chose them. They picked them. That's what they do. So yes, and the thing is that episode was written, from what I understand, that episode was written January 2025, before any of this actually started. It's like they knew it was coming. I mean, we all most of us knew it was coming. Yeah, the staff leaving shocked me too, because I guess they said that some of them were in protected status, which today we know means nothing, right? Doesn't mean anything. Protected status, legal status doesn't mean anything. They can take whoever they want whenever they want. And they're not held accountable for any of it. Not yet. I think the day will come they will be, but they're not right now. Oh, so Michelle, there are actually some very funny bulls. Yes. There's a couple that believe it or not, there's a couple I follow on TikTok that are hilarious. Rufus the bull. Look him up. He's funny. And he's big and strong, but he's, kind of a big old baby. So yes, even bulls can be cute. And my 8-year-old would think they're cute too. He'd want to pet them. Let's see. So Danny, you say I think they are forgetting that they are humans and deserve kindness and dignity. Who are we talking about? The ICE agents weren't really causing a fuss, just standing around. No, I think they were. They were pretty aggressive. They were standing outside of the. They weren't in the room with the patient. They were, and then they would not allow them to finish treating the patient. And then when they started hurting the patient, Jesse stepped in, and then that's when they tackled him. Which there's no reason to, because you got to remember, legally, ICE agents cannot detain U.S. citizens, and yet they're doing it anyway. And they're not only detaining them, they're taking them away and disappearing them for like days at a time. Danny, like I'm kind of at that point now. If you are still working with that agency and you are still participating in all this, I feel like I don't know. I feel like you're working for the wrong team. I really do. And the things that they're doing, I just don't agree with. And I don't support that at all. To do what they're doing, no. No. Not on that team. I'm sorry. Like, if that causes you to unfollow me, I'm okay with that. But no, I don't have any empathy or sympathy for ICE agents at this point. 0. We're a year into this, and if you're still participating in all this, you're not on the right side of history. And the fact that so many of them are people of color and have accents, that just, you know, terrible. Like, they hired an immigrant who was here in protected status. They hired one. He showed up for his first day, and they arrested him and detained him. It was he was here legally. Why? Because it's their quota. They gotta meet their quota. Once I got a seafood allergy reaction, I could that's bad. That's anaphylaxis, so hopefully you have an EpiPen now. They had to give me some kind of antihistamine. Yeah, famotidine would be the most common, but if it's anaphylaxis, you're gonna get an epi injection, and that's just temporary. I don't know why. I don't know what your definition of a huge needle is, but an EpiPen, if they used an EpiPen, that's small, and even if they drew it up, then that should be a fairly small needle. Let's see, I'm a nursing student. I'm scared I won't remember anything. That's legit. Everybody who's been through nursing school has that fear. It's just you gotta manage it as best you can. Trust that you'll remember. Yeah, I mean, like a 25 would be fine. 25 gauge, that's pretty small. That's typically what we use for our IM injections. I mean, you can go like 23. It depends on what you're giving. If you're giving Ativan or you're giving like penicillin or ceftriaxone, those have to be large bore needles. Like penicillin's got to be like an 18 gauge. It's so thick you can't push it through anything other than an 18, and it actually can cause more tissue damage. So if you're going to give injections with Ativan, IM, or Recefin or penicillin especially has got to be pretty large bore. Yeah, I'm not a psych nurse. I do handle psych patients from time to time, but it's not my forte. It's not what I'm the best at. I'm best at, I guess, trauma, really really sick patients, and ultrasound IVs. The syringe was thick and the needle was big gauge too. Yeah, well, they had to give you something. I don't know what it was. The only thing I've ever had to give through a large bore was like penicillin. Ativan can be with a smaller, doesn't have to be quite as big. Let's see. Yeah, 25 gauge. That's what we would use. 21 gauge. Woo. Okay. I mean, I guess we use 21 to do like blood draws. Like our phlebotomy kits are 21 and 23. So that's not terrible. But like, I don't think you wouldn't be able to do Ativan with that because like Ativan is hard to draw up. Like if you try to draw it up with like a 20 gauge, it is like drip, drip, drip. So you better get an 18. I mean, you can do it. It's going to take a long time. And I think if I remember correctly, if you try to push a med that is thick, like through a smaller bore, like a smaller gauge, it can actually cause tissue damage. If I remember correctly, I have to double check that. So yeah, that would be my concern with that. So sometimes you got to go big. That's just how it works. Let's look it up. Gauge IVs, gauge needles. Here we go. Yes, forcing medication through small gauge needles can cause significant problems, including increased pain, needle breakage, and medication degradation. So there you go. That's why some meds you got to push with a larger gauge, larger diameter gauge. And I wish the medical field could be more consistent with how we size things, because for IVs, needles, the smaller the number, the bigger the diameter, right? So like 14 gauge garden hose type IVs. But then when you go to like your Foley catheters, it's the opposite. The smaller the number, the smaller the catheter. So like an 8 is like what we use for straight cas, and then you've got like all the way up to like 24 French or whatever. And those get big. Oh, you ever seen a 24 put in somebody in a Foley? Yikes. Thoughts on a career in paramedicine? Think it's great. Think it's great. I work EMS. I'm not a paramedic. World and mock exams. Oh, for nursing school. So our nursing school built in all the practice exams were Kaplan. And so they built that all in through the length of the program. So by the time we graduated, we'd done like 5,000 practice questions or something like that, including some like time tests where you simulated taking the NCLEX. So I felt pretty prepared by the time it came to take the NCLEX for sure. So that's how I reviewed it. That was for Daisy Baby. I didn't use anything else. Kaplan, which is what our school integrated, that's what I used. And I didn't use anything else. Any tips for psych because I'm on edge and I have to pass this final? Oh, I don't know. I don't know. I don't have any tips for that. I barely survived myself. I think just do your best. Don't study the night before. I mean, the morning of. Study, go to sleep, get up, have something, have a good breakfast, take a nice shower, get ready for your test and just take it and just do your best. But I mean, like, I don't know what your focus is, and things have probably changed since I took the test. Oh, there you go. Lauren's got some tips. Slide by slide, rewrite what you remember, and then do practice questions. So from like reviewing books, I would always just skip to the end of the chapter and look at the review, like the bullet points for each chapter, and just read those. It's very short, it only takes a couple minutes per chapter, and it gives you like the highlights of it. That's what I remember doing. And then for chapters that you didn't have time to read, literally just read the subhead, like the headers, subheads, and the first sentence of each paragraph for the introductory for that section. And then the end of it, read the bullet point reviews. That helps, I think. I got surgery on the 25th. How can I now take the patches off to clean under them and air out on my belly? Patches? It depends on what patches. Are they pain patches? Because typically those have to come off after a certain amount of time, 12, 24 hours, depends. They should have gone over that with you during your discharge. But if you have any questions post-op, make sure you call that office and tell them and ask them. Oh, Kevin says use AI to help review. We did not have AI when I was in nursing school. The I see, the dressings. Yeah, sometimes they want you to leave those on until you follow up with them. So before you take anything off, if you're not sure and it's not in your discharge paperwork, call them and make sure that you're doing the right thing. I don't want to tell you to do one thing and they've already told you to do something else. But it's not uncommon to like forget or maybe somebody didn't go over it with you. So just call the office and ask them, "Hey, what am I supposed to do with this bandage? Do I leave it on? Can I take it off?" And they'll tell you. AI practice questions are so good for med surge. Oh, very cool. I have clinicals tomorrow with my students, back on med surge floor. So we're gonna be looking. I'm gonna see if we can get them some IV starts because they really need that. That's one of the biggest problems that we have in nursing school is not training them how to do that. Tiny Titans Collective, thank you for the daily heart me. I appreciate that. Yep. Call the office and check. I'm not a professor. I'm a clinical instructor. To be a professor, I'd have to have my doctorate. I don't even have a master's. They used to require masters to do clinicals, which is the most ridiculous thing. So they've relaxed that now, um, which is good because if you want to teach clinical experience to your students, then you need somebody who's actually practicing, not somebody who used to. Because a lot of my clinical instructors were not practicing nurses; they were instructors, and they had not been bedside for a while. So they've since changed that. Now clinical instructors just need a bachelor's degree and like I don't know how many years experience. What jobs can you do in the ER without college? It depends on the ER. We have a lot of techs that may not necessarily have a college degree. Um, I'm trying to think. I guess techs would be just about it. Ward clerks, but to be a nurse in the emergency department, you're going to have at least an associate's degree because we don't have LPNs in ours. So you would have to have at least an RN, which would be an associate's degree or a bachelor's degree. And I think all of ours have bachelors. No, that's not true. They don't. Not all of them do. Some of them are associate degree RNs, but they are working toward that. Oh, authentic nurse Noah. I was talking about you earlier. It's like Beetlejuice. No, we were talking about that somebody had a question about endometriosis, and I, you know, admitted that I am not well versed in that, but I had seen your post about that. So I directed people to go follow you. So this is authentic nurse Noah. He is more well versed on endometriosis and treatments and pathophysiology than I am. So if you have concerns or questions about that, he's a better resource than I am. So I recommend you follow him. It's so funny that we were just talking about you not too long ago, and then you show up here. But it's good to see you, man. I hope you're well. Let's see. Hey, friends, got a stay-at-home mom, medical mom, NICU preemie mom in Illinois. Okay. Well, I hope your baby's doing okay. I heard transport, like taking a patient room to room cleaning. Yeah, yeah, some hospitals have transport. Like we do not have our techs do all of our transports. So not all, but they do our transports. We do a lot of our own. So that's time to do the puzzle piece. Oh, gotta try it again. Fat fingers. There we go. Um, and then I guess our admin folks at the front desk that check people in. Yeah, you don't think you necessarily have to have a college degree for that. I mean, college degrees are not what they used to be, right? Used to be like a guaranteed job, guaranteed career. That's not the case anymore. And we're losing so many of the trades now, electricians, plumbers. I mean, those folks make pretty good money. It's hard work, but they can make good money. And we're losing some of that. So we've kind of changed the narrative with our kids. Like they're like, oh, we want to go to college too. And it's like, well, it really depends on what you want to do. You don't necessarily have to because it's definitely not what it used to be. Oh, they are 8, 3, and 2 now, but my 3-year-old was born at 22 plus 2, and we end up in the ED quite often. Oh, I'm sorry to hear that, but, I mean, I'm glad they're all still with us. Knowing the correct job titles to look for is super helpful. Always wanted to be a nurse. There you go. If you wanna be a nurse, go for it. There's all kinds of nursing you can do. LPNs, RNs, you can work in any different so many different fields. You can work hospice, palliative care, ER, ICU, in hospital, out of hospital, home health. Let's see. This is Blondie. I'm 13 days post DNC. I've had bleeding all day. Could that be my period? If Nurse Noah, authentic Nurse Noah is still in here, he's a nurse practitioner that deals with this. He might have, but I would say any bleeding that is out of the ordinary, the first thing you need to do is call the surgery office, like whoever did your surgery, call them and ask them. Um, but and then outside of that, like if you have any concerns, you need to get to an emergency department. Gary, would you want to become an MP? At this point in my life, no. I'm 51. That's 4 years of school. Like that's if I do part time. Part time would probably be like 4 or 5 years. Minimum of three. Like three if I did full time. Can't afford to take that time away from work, especially with young kids. I'd miss a lot of time at home. And then what does that get me? By the time I'm graduate, I got like 9 years left, and then I got to work how many years to make up for the income I've lost. It just didn't make any sense for me. I did apply to University of Alabama many years, like 4 years ago, I guess, and, decided not to. When we did the cost benefit analysis, by the time I'd break even, I'd be close to retirement, so it didn't make any sense. So, but Blondie, I hope you're doing okay. Either, call or go get evaluated, and don't drive yourself. Have somebody take you if you have to go. Got my William and Mary Tribe Pride. It's crooked. It's been crooked for years. Love our Tervis tumblers. They last forever. You do hot and cold. Love them. T Lady, thank you for the Panther paws. Appreciate that. Here's the thing, though. I will say, I love Tervis tumblers. They will last forever. If for some reason they don't, they will their lifetime warranty. They will replace it for free. But here's the thing: you got to send the old one back. To send the old one back will cost you more than just buying a new one. So yes, while they will replace it for free, it doesn't. You would end up spending more money. Just go out and buy a new one. Because if they can't replace it or it's out of stock, they don't make it anymore, they're not gonna replace. They're gonna send you like an alternative version of it. So, yeah, it's a great policy on the surface, but when you look at the cost, because I did that, I got a cup from them. It was a Washington Nationals, cup, and it was, like, not stamped right, so it had a really rough rim around it, like, the plastic hadn't been sanded down, and so I was gonna send it back, and I was like, "Oh my gosh, it'll cost me more money to send it back than it is to just buy a new one." So, yeah. Thank you, Brandy. I appreciate that. Snickerdoodle, thank you for the follow. T Lady, y'all have a good day. You as well. Ari's in the house. How you doing, Ari? I was going to ask. I was trying to remember when your test was. It's today. Well, we wish you the best of luck. Let us know how it goes. We'll be live tomorrow morning. So just let us know how it goes. I'm off all week. I'm off until like, I don't know, middle of next week, Wednesday of next week. I have no doubt Ari will pass. The question is, will Ari do as well as Ari wants to do? I think that's the real question. Has Ari reached the point of nursing school where she's happy with a passing grade, or is she still wanting to get that 99% or 100? Because I think by the end of nursing school, you're just like, oh, just let me pass this exam. I just need like a 81. Yes, Holly. I totally forgot about that. When I did our schedule, like when I was trying to plan out my leave, this is our kids' spring break is starting on Wednesday. They only go to school 2 days this week. So I was like, well, we'll just take off because we might go somewhere and then I'll have the whole week off. And then I totally forgot about it. And we ended up not doing anything. And so I had totally forgotten I had these days off until I saw my leave request approved. And I was like, oh yeah, that's right. I took off. Sweet. It's theory. So it's the main 5 credits. Oh, so you got to get a good grade on this. Flicky Bear, thank you very much for the follow. I appreciate that. Yeah, it's a nice break. And then I won't get another break until July when I go on Disney cruise. Shaza, good morning. How are you? We're on for I don't know. I guess we'll go till 7:45. That's what we usually do, like an hour and 15. Michelle, thanks for the follow. Appreciate that. We're talking anything. We're talking. I have a plan to talk about the pit, and we talk a little bit about it, and then we get questions. So we just kind of like we go down the rabbit holes, and that's fine. I'm also simulcasting over on my Substack. I don't even know if anybody's over there. I'll take a quick peek. No, it's been on for an hour and literally nobody's over there. But that's fine. I think it records it and publishes it over there. That's cool. But you got to be there, right? That's why we have the 2 mics. This mic is going to the Substack and this mic goes to TikTok. What's the worst thing I've seen? I'm going to tell you what it is, and then you're going to have to look it up because I'm not going to explain it. Bilateral self-enucleation. Those that know. There you go. I will make an A. I love it. That's right. You will make an A or B. Just do your best. Because remember, when you go on to apply for your first nursing job, they don't care what your GPA is. All they care is did you pass the NCLEX? That's what they want to know. Literally nobody has ever asked me what my GPA was in nursing school. Nobody. The only place that asked that was the application for nurse practitioner school. That's it. That's the only people that have asked. Ooh, good music. Samila, thank you very much for the follow. Appreciate that. Let's see. I can figure things out if I actually spend time, but I get anxiety and rush. Yeah, just take your time. When you did nursing school, were the scales also tipped? I don't know what you mean by that. Explain. What do you mean? Were they tipped? Oh no, 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 no. Our school changed their grading scale the year I started. So it used to be like 90 to 100 was an A. They changed that. So it was then like 93 to 100 was an A. And anything less than a B was failing. So if you got a C in a class, you failed that class. So no, I would say it's tipped, not in my favor. Yes, they were tipped, just not in my favor. Ah, the killers. 80 was a C at nursing school. So yeah, I guess 80 was a C because it wasn't a 10-point scale. So you had to have a 84 or whatever it was. Let's see. So yours is still 10, like kind of a 10-point scale. Oh yeah, I think 84. I don't know. I can't remember, but it was like they had just changed it. We're like, dang it, because if I had gone the year before, I would have like graduated like summa cum laude because I missed it by like 0.04, which really irritated me. Mine is kind of normal, but a C is shorter. Let's see, Charlotte, Australia nursing at my university. We can pass with anything over 50%. That grading is just different. Yeah. Like on the surface, like, oh, 50%, that's terrible. But it's probably the way they grade it. So I wouldn't really think anything less of that. I don't know what a C is shorter. Like the range is shorter. Lisa Magical joining. Good morning. Oh, so here's what a small world it is. So one of my mutuals on here, and made a comment of something about where she lived. And I was like, no way. Like, I didn't know you lived out there. I said, my brother's out there. And she go, really? Because it's kind of a small town, right? So that's already a small world. And then she's like, oh, well, if he lives here, then he's probably been to my family's restaurant. So I text my brother. It's like, hey, have you been to this restaurant? He goes, oh, yeah, we go 2 or 3 times a year. I was like, small world. Then he goes, why? You ordering for me? Do you work with residents and med students? I do, but not in the emergency department. We don't have them in the ER. So my experience with them is when they come to admit a patient, it's usually the residents and med students who will come. Now we do get med students from time to time that'll rotate through, do histories, talk to patients, that kind of thing, get their patient contact. But in terms of like residents, I don't see them until they come to admit a patient. And I actually know a lot of them because 'cause they've come through the rescue squad where I run. We have, like, 2 or 3 medical schools around here, and they feed, like, their med students. They come through the, rescue squad to get their EMS and patient contacts. And then I'll see them when they come through their rotations, which is kinda cool. They're growing up so fast. Good morning, Gypsy RN, welcome in. Kid RN 72, thanks for the follow, appreciate that. Juliet's in the house. Juliet is in an accelerated BSN program, so she's going through it. Biggest thing that matters is our exam grades, and they have to be 77. Okay. Is the pit legit? It's too legit to quit. Sorry, that was really bad. Yes, it is legit. As far as medical dramas go, it's pretty accurate. I would say it's the most accurate representation of what working in a level one trauma center is that has been on television ever. I've seen a lot of shows, and it is the most accurate there is. Is it 100% accurate? Absolutely not. There are a lot of issues I have with it, but it's better than House. I'd say it's better than ER. Now, I didn't work in healthcare when ER came out. So I was in college first time. I was in college when that came out, and it was on the air for 15 years. I did not watch all 15 seasons. And to be honest, I'm not even sure I watched until Dr. Green passed away. Like, I don't think I only watched it for, like, maybe 4 years. Good morning, the Megan Marshall, the Megan Marshall. You need to capitalize the, like, the Ohio State, the Megan Marshall. Let's see, Gypsy RN, what is the question we're asking? I see I'm applying EM for residency this year and love to ask nurses about. So here's my advice if you wanna get in good, um, as a as, like, a medical student, and I would say that's pretty simple. You just gotta, 1, just do something nice. Like, instead of saying, "Hey, that patient in bed 5 needs a blanket or wants something to drink," say, "The patient in bed 5 is asking for something to drink. Where can" 1, can they have something to drink? And 2, where do I get it so I can take it to them? And, the fact that you offer, most ER nurses are gonna be like, "Oh, well, I really appreciate that. Yeah, I'll take care of it, but I think, thank you." And then they'll remember that. The other thing is, one of the stories that I always tell is we had um, a medical student who was going through the ER doing their, rotation, learning how to do patient histories and whatever, but she used to work in an ER as a tech in her hometown. So we were having a particularly busy day, and she recognized that, and she wasn't doing anything at the moment. So she jumped up and started making beds. And we were like, it's, we would appreciate that, but we can get it. She goes, I know you guys are busy. I wasn't doing anything. I used to be a tech. I can help out. Like an angel. Like she wore a halo for the rest of eternity in our minds. And it didn't take much. Like she could have made one bed. She could have brought one blanket. It doesn't matter. So if you do that, you will make an impression on the nurses and word will spread. Hey, that med student, she's the real deal. So yes, I think that is what I remember. And yes, don't touch the pumps. Don't touch the pumps. If the pump is beeping, come tell a nurse because we need to know. Addie was an ER tech before med school. So yes, you will be fine. But if you demonstrate the willingness to jump in and help when it's needed, they will remember you forever. And you will, like, when she came back for her residency and she did her residency rotation through the ER, I mean, she was like a legend at that point. And she never let it go to her head. She continued to help us when we needed it. Is it worth nursing school? Yes. I would say this though, I would not fall for the four-letter, four-year university. It's a lot more expensive. It doesn't mean that you're gonna get a better job, or get it over somebody else. Look at your community college program to see if they offer, an associate degree. If they do, make sure that they're accredited and make sure their pass rate for their NCLEX is, I'd say, 90% and above. As long as it's above 90, I personally would be okay with that, and you'll save a ton of money, and hospitals don't really care if you have your BSN, because if you don't have your BSN, they will pay for you to get it in most cases, and that's free money. So, the mistake I made was falling for the prestige of a four-year university. That's not necessary. Some of the best nurses I've ever worked with have associate's degrees. That's right. In this day and age, you can never save enough money. Times are tough. All right, we got about 4 minutes left, and I gotta get off here and get my kids to school. They're only going for 2 days. Like, how much are we really gonna do in 2 days? I think today's mostly makeup days for their whatever, their standardized tests. Yes, guys, listen to him. I need to I'm actually gonna do a podcast, a solo podcast episode on this. Maybe I'll record that today. I had to put it off because I had that bronchitis for, like, 2 months, and I couldn't really get through, you know, a whole recording without coughing a lot. So I might do an episode on that, a solo episode, like 20, 25 minutes, just kinda, like, detailing, you know, the differences between associate's degree and a bachelor's degree. Do I regret my bachelor's? Not really. Like, I learned a lot. It was great. I didn't have to go back and get it, but I'm still paying that loan off. And if I'd have gone to a community college, which we have one here that does an associate degree program, I would not have student loans right now. So save your money. Make sure it's a good program, though. Don't go to like some fly by night thing. Make sure they're accredited. Make sure that they have a good pass rate on their NCLEX. Addie, thank you for stopping by. I appreciate you. Good luck to you. Thank you for the follow as well. Looking forward to seeing your journey. I live stream most mornings around 6:30. Fridays are a little different because my kids usually go to school early. During the summer, it'll be different, but they go to school an hour early because they have chess club. They're both in chess club, and they can at ages 8 and 10. Both of them can beat me regularly. The 10-year-old also can solve a Rubik's cube in like less than 2 minutes. I've never solved a Rubik's cube in my life, so he is. They're both way smarter than me. Finding peace, Dwight. Thank you for the follow. I appreciate that. Down to 2 minutes. I usually like to close out my live streams with asking about any special occasions. We know Ari is taking a test today. We wish her the best of luck. Do you have a birthday coming up? Anniversary coming up? Anything that you want to celebrate? We will throw it out here and wish you all the best of luck and a wonderful day. And don't forget to check out my friend Allison. She runs Rogue Nurse Creations, the Wilted Daisy. If you ever heard of the Wilted Daisy, that is her creation. You can find her on TikTok at Rogue Nurse Creations, and she's got a lot of great nursing centric stuff, quality stuff. Finding Peace, my daughter is in the associate degree program. Excellent. Oh, and the other thing is you can go to my bio and you can find links to a bunch of other stuff where you can find me. Like I'm over here on these two things, and we've got a Discord as well. But you can go to my bio and find links to all of that. The Pit is very accurate for the most part. There are definitely some things that are not, but as far as medical dramas go, I mean, you're not going to find a more accurate show that depicts a level one trauma center. I think one, I'd like to see more respiratory therapy because I think they're much more involved, especially in cases of respiratory distress or intubations. We see respiratory for almost all of those where I work. And I feel like we've only seen them like one scene, right? The nurses are becoming more prevalent in the episodes. I feel like there wasn't a lot of focus on the episode on the nurses other than Dana as the charge. She plays a very important role. But I really, this whole episode with her carrying Versed in her pocket and then giving it to that guy that assaulted the student nurse or the new nurse grad, that's weird, right? Like I would never do that. Like Ativan is a controlled substance. I would never do that. So that part definitely was kind of weird. And Robbie called her out on it, right? Like, he said, like, I'll write the order, but like that's your license that you're risking. And her rationale was I saved a nurse's life. Yes, maybe, like, by the time you saw her getting choked out, you could have called for help. Like, help could have come and separated them, but to give him an injection without a doctor's order and one carrying a controlled substance in your pocket, yeah, man, that's risky. That is risky. That puts Robbie in a very awkward position. So I don't know. We can talk about that more next time. But yeah, that part was like, oh dang. Like, I don't mess with that stuff. I make people like I'll have nurses like, oh, you're good. And I'm like, no, no, no. You're gonna stand here. You're gonna watch me put it in here. You're gonna watch me waste this medication because I'm not playing that. I don't need that to ever come back on me. The only well, see, Narcan's like you can get that over the counter now. Like that's not even like I don't have an issue with that at all. That's a good idea. I should carry that. But they've made it to the point where we can barely override medications now. Like I can't override Toradol, you know? The only thing we can override are our stroke kit and I think we can override Ativan for Met codes. What we call it Met code, medical emergency team code. We can override that and that's it. But then like that tracks you. You override it. Now that's tied to you. You better make sure you have it. So yes, I've Narcan people in the parking lot. People run and be like, oh, he's, not breathing. I can't get him to wake up. And then you literally roll out there with Narcan and squirt it in their nose and throw them onto a stretcher and get them inside. So A&E assessment help. Oh, we're signing off. You can DM me directly, and I might be able to help you today. Maybe we'll have time to go live later today and do another Q&A once I get the kids off to school because I don't work today. Tomorrow's clinical day. I'm very excited about going to clinicals tomorrow. My students are wonderful. It's going to be a great day. I saw a lot of people I used to work with. I hadn't seen in a long time, so it was great to kind of catch up with friends. So anyway, it is time for me to jump off of here. Y'all, another wonderful live. Thank you all for the questions and the comments and the follows. I appreciate that. We might do a bonus live today. At the very least, we'll see you tomorrow morning around 6:30. As always, be kind to others, be kind to yourself, prioritize your mental health. I'm Gary, the ER nurse. We'll see you tomorrow morning. All right, Substack. That was awesome. Awesome to nobody. All right, y'all take it easy. Have a good day.